I'm Gaynor from Miami Physiotherapy and Lakelands Physiotherapy, and today I wanted to talk a little bit about prolapse. So pelvic organ prolapse is probably the biggest secret in women's health. There are millions of women who suffer with prolapse, and a lot of them unfortunately suffer in silence. Pelvic organ prolapse affects 50% of women who have had children, so that's a fair percentage. So what is a prolapse? Well, basically a prolapse is when either the bladder, the bowel or the uterus bulges into the vaginal space and also can sometimes descend down into the vagina. So it is a real issue with women of all ages. It becomes more of an issue as we age, particularly with menopause and the lack of oestrogen. But also the main cause of a pelvic organ prolapse is childbirth, especially multiple childbirths or having large babies and difficult vaginal deliveries. So some of the symptoms of prolapse can include a dragging sensation or dragging pain in the pelvis or into the vagina, a dragging discomfort or pain in the low back also. You can also get symptoms where you can actually feel a bit of a bulge or some tissue inside or even coming out of the vagina. You can get difficulty with bladder and bowel function, so any incontinence or leakage of urine, any trouble passing the bowel movement. So any of these symptoms, I do urge you to get it checked out by a women's health physio or your GP, because the key to prevention and management of prolapse is early detection and early treatment. So there is a lot that we can do as physios to help with prolapse. And the main thing is detecting it early. So it doesn't necessarily mean an internal examination. You can come in and we go through a thorough questionnaire and find out what your signs and symptoms are, and from there there's a lot we can do as far as treatment. So sorting out bladder and bowel dysfunction can be the big things. Other big causes of prolapse is being overweight, smoking, straining a lot to go to the toilet, or constipation, a lot of heavy lifting, so either in your work or doing a lot of heavy lifting and exercise or weights at the gym. So things like CrossFit, F45, we're seeing a lot more trouble with prolapse. And that's because the ligaments and the connective tissues around the pelvis and the pelvic floor muscles become weakened. So the big thing we can do as physios is to rehabilitate the pelvic floor muscles. So we can help you to find your pelvic floor and to work on exercising that pelvic floor so that we prevent any further prolapse or worsening of a prolapse. So if you're worried at all that you may have some symptoms of a prolapse, you can come in and be assessed, and we can go through quite a few different steps to try and help you to prevent that prolapse from worsening. So if in doubt, see your GP or come and see me at Miami Physiotherapy or Lakelands Physiotherapy.